As a family physician, you're getting to know your patients and their families, taking a whole person approach to each patient, providing comprehensive health care through all stages of life, listening and developing the trusting relationships that improve the quality of your care and your patients' lives. Isn't that what a patient-centered medical home is all about? Yes. But the patient-centered medical home also formalizes these practices, establishing criteria for recognition as a medical home, and changing the payment structure for physicians by recognizing the added value of the medical home approach. In short, the patient-centered medical home is a better way. Watch with us to learn why Wisconsin and the nation need patient-centered medical homes. Steps to achieve recognition, complete with improved patient care and satisfaction, enhanced payment, and higher physician and staff satisfaction. We begin with a story you've probably heard before.
Last summer I had an experience that was, I would call, not very favorable.
With her primary care doctor out of town and suffering severe arm pain, Joan Schilke spent $3,600 and a day of time between a walk-in clinic and a hospital ER.
They sent me home with some ibuprofen and said, you're not having a heart attack.
By the next day, Joan's primary care doctor was back.
She took one look at my arm and she said, well, you have shingles.
It was a simple $60 diagnosis.
About $2,800 or so I paid out of pocket.
Such stories happen daily in our complex, confusing healthcare system. Procedures seem to take precedence over preventive care. We worry about our medical bills, and as patients, often wait until we're sick enough to see a doctor.
Yeah, if you wait until you need acute care to see a doctor, the doctor's going to pay attention to that acute care. But you may miss an opportunity to get some preventive care.
The problem is, our current healthcare system is broken. Our doctors are paid only for the most expensive things they do, like face-to-face visits and medical procedures. Our system doesn't emphasize preventive care. Family physicians know an ounce of prevention is worth a pound of cure, but not in our healthcare system. Because so many of us wait too long to see doctors, complications force us to see more specialists or go to emergency rooms, and all of this costs a lot more money. It's no wonder healthcare costs have gone into orbit. We're spending $2 trillion annually on healthcare, and we're not even that healthy. We're spending the money on treating illnesses, not helping people stay healthy. Something needs to change. What if you could have a primary care doctor who really knows you, someone who works with a team of medical professionals taking care of you most of your life, people who know all about you, who listen to you, who coordinate all of your care, even when you do have to see a specialist? What if you could have a medical place to call home, someplace convenient where you could actually call your doctor on the phone, see your doctor the same day you got sick, find resources for self-help when that's appropriate? I mean, how complicated would that be?
We're all trying to provide the best possible care we can.
At the individual doctor level, there are many of us that try to do this, but it's hard. The system stacks up against us.
The World Health Organization ranks our healthcare system 37th. We're barely better than Cuba. 2,200 family physicians here in Wisconsin and thousands nationwide, plus a growing list of U.S. corporations, know the current healthcare system must change.
We've developed a system in the United States where people go to a specialist who takes care of a particular system of their body or a particular disease and doesn't always look at the entire person.
A concept called the patient-centered medical home has the power to fix our broken system, and it's creating a buzz nationwide.
Well, the idea of a medical home has great appeal because it's an organizing concept.
The patient-centered medical home has a whole patient approach to it. In the patient-centered medical home, the team in that home, led by a physician, is going to care for the entire patient.
The concept is kind of like it takes a village to raise a child. It takes a team of people to really provide great care.
One of the ways I think about it is the analogy of the old television story Cheers, where everybody knows your name.
In the patient-centered medical home, care is coordinated by one physician leading a team of medical professionals. Collectively, they take responsibility for continuous, comprehensive care through all stages of life, from cradle to grave. Care is preventive, integrated, well organized. It's characterized by effective communication and based on continuous healing relationships. Care is also coordinated across all aspects of a patient's life, including the healthcare system. Patients have greater, faster access to their physicians and are also empowered with the resources to care for themselves. Patient-centered medical homes also promote listening to patients.
It didn't feel like the doctors really listened.
The person that's going to define how well I'm meeting their needs is the patient.
We're learning that we can't do it all ourselves as a physician or a nurse practitioner or a physician assistant. We need to work within a team of people whose main goal is to reach out and understand what that community we serve needs to heal.
Where the patient-centered medical home concept is taking hold, it is achieving the best of both worlds, lower healthcare costs and better healthcare outcomes.
Dr. Rako has been able to, take the time to listen, to understand me, to guide me, to other areas that have been helpful in helping me from a medical standpoint, but still being that central spot to come back to and provide me with a base.
Study after study show that patients with an ongoing continuous relationship with a family or other primary care physician receive better care. In the U.S., adults with a primary care physician have 33% lower health care costs, spend less time in hospitals, and are 19% less likely to die from their conditions than those treated by a specialist. Patient-centered medical homes combine the improved health care of these relationships with improved health care practices to produce enhanced health care outcomes and increased cost savings. It's estimated that if everyone had a medical home, health care costs would drop 5.5%, saving Americans $67 billion yearly in health care expenses. That's more than $200 for every man, woman, and child in the country. Major corporations, insurers, consumer groups, and primary care doctors are embracing the patient-centered medical home. Many states and localities are incorporating the medical home concept into their funded healthcare programs. In Wisconsin, practices like this and others are turning to the patient-centered medical home concept. The difference is apparent. Are you happier?
I can't, begin to explain how much happier and much better it is for me.
Two patients, two entirely different outcomes. The difference is the patient-centered medical home concept. It's not a pipe dream. We can lower the cost of health care and make all of us healthier. To begin your journey to recognition, share this video with others in your practice. Hold team discussions about the benefits to your practice and to coordinating the steps toward recognition. Network with other Academy members about the benefits of a medical home to patients, physicians, and clinical staff. Explore the wealth of information and resources at wafp.org/PCMH. Take the MHIQ at transformed.com, accessible from the PCMH website. This free, easy-to-use tool from the American Academy of Family Physicians makes it easy to benchmark your practice's current performance. Work at your own pace. Even set easy email reminders to return to unfinished modules. Once you've completed all 8 modules, compare your Transformed Medical Home IQ answers to National Committee for Quality Assurance answers. By comparing, you'll see how your practice stacks up and receive recommendations regarding what else you can do to help achieve formal recognition by the National Committee for Quality Assurance. NCQA has established the Physician Practice Connection's Patient-Centered Medical Home Standards in conjunction with AAFP and other major primary care physician associations. There are 9 PPC standards, including 10 must-pass elements, which can result in one of 3 levels of NCQA recognition. Throughout your journey, stay in touch, active and connected with the Wisconsin Academy of Family Physicians. Watch for valuable information in our electronic newsletters and other emails. And call or email if you have questions. We're the Wisconsin Academy of Family Physicians, promoting excellence in healthcare, advancing the art, science, and specialty of family medicine, and the professional growth of family physicians. WAFP, strong medicine for Wisconsin.